Well, good afternoon. I'm Dr. Mark Cooper, and I work in the field of chronic pain management. I'm a psychologist working in that field. I also have a doctorate in natural health. Um, in this country, we really have had an opioid epidemic that's occurred over the last 15 years, where patients have gotten in trouble over taking pain medications. And we really are now in a situation where we need to find some alternative strategies for these opioids and to help people. And that's one of the things that I have done my whole career. And I want to share with you some of the things that might be of help to you in terms of natural health strategies and specifically nutritional supplements that help joint pain. So hopefully you can use some of these strategies and avoid some of the pharmaceutical drugs, or at least be able to cut some of those pharmaceutical drugs down so you don't have to rely upon them only. I call this the ABCs of joint pain because I'm going to talk about some supplements that some of you may not have heard about before that actually are that do pretty well. In fact, inadvertently I found out some of these things by testing them on myself. I had some colds and viruses and was sick, but I've always had some joint pain. And I started taking some supplements from the natural health field actually for colds and viruses, and I noticed my joint pain actually felt better. And then I started doing a little bit more research and found out that these are some of the same ones that have been used for a long time. So I want to talk about them. I call this, again, the ABCs of joint health. First supplement you might want to consider is ashwagandha. And that really is a supplement from Ayurvedic medicine that reduces inflammation, or helps reduce inflammation. It combats free radicals. It really works as a natural anti-inflammatory, and it boosts up the immune system, and it helps with stress. So that would be one you might want to consider. B, that's boswellia. Boswellia, as you know, is frankincense. And frankincense was one of the things that was brought to the baby Jesus, and for good reason. It again is a supplement that's traditionally used in alternative medicine as an anti-inflammatory, but it boosts the immune system, and some areas even use it as a way of helping your body become unfriendly to cancer. So you might think about that. Now, C is curcumin. Curcumin really comes from the spice turmeric. And turmeric, by the way, this is a curcumin capsule. And this is a boswellia capsule. And this is my ashwagandha. So curcumin comes, really is from turmeric, and turmeric's a spice. But it's been used, again, as a natural anti-inflammatory. And it is also used for brain longevity, and that might be something you might be considering, especially since as we get a little older, we sort of worry about those things. So curcumin might be something else. Also, vitamin C, and I like vitamin C with bioflavonoids, or what we call vitamin C liposomal, or liposomal vitamin C. Now, the liposomal version is a little more expensive, but it boosts up the content of the vitamin C in your bloodstream, and again, it's been used as a build the immune system as well, but also helps with bone health and osteoporosis. So if you have a lot of joint pain and have an underlying osteoporotic or osteoporosis kind of concern, then you might want to consider taking that. Usually 1,000 milligrams twice a day is probably enough. Sometimes people need to take a little bit less or a little bit more. Just talk to your doctor about that. Also, vitamin D. So we got A, B, C, now D. And vitamin D is D3. Vitamin D3 has become much more important for a person's health, especially if you've got fibromyalgia or arthritis, because it really helps with bone health and osteoporosis and osteoarthritis. And some people need different amounts. That's become more popular in the traditional medical approaches, but most of the time people still are not really taking as much as they really need. Some people need 1,000, and some people need 10,000 per day. The best way to look at that is to look at your blood work. A normal range is from about 30 to 90. But in my practice, and what I have found people do best if they can get their blood level above 50. Now the next one would be maybe ginger root. Ginger root works as an kind of a natural anti-inflammatory, and also with helps with nausea and vomiting, seasickness, travel sickness, and that may be in some GI issues, but it works as a natural anti-inflammatory. But I do want to mention something about all these. Every one of these, the more you add together, they all have, they're what we call proteolytic enzymes. And that means that helps dissolve the fiber in the blood, which also means it kind of thins the blood. So if you've got arthritis, but then you're taking something like Coumadin or a blood thinner, you really need to talk to your doctor about those combinations, because they do interact, because they thin the blood even more. All of these do. So you just have to watch out for that issue. Glucosamine chondroitin is another supplement that's been on the market for a long time for people with arthritis. I have found that it helps some people, maybe 20 to 25%. The people seem to get a benefit from it. I took it for several years, didn't find it all that helpful to me, but I found the supplements I mentioned above actually to be more helpful to me than the glucosamine. But I don't have any objections to people taking that, and usually people tolerate it pretty well, and that may be another good thing to add to your supplements. The next one will be magnesium. I happen to like the magnesium citrate form, which comes in a pill. Usually you take that in the evening. That's been very helpful for restless leg syndrome, cramping in the legs, and especially if you're a weekend warrior, or you're like me, you work during the daytime, but on the weekends you actually work too much, and then your legs are cramped. Taking about 200 to 400 milligrams of that at night really helps with that. It also helps with migraine headaches. So if you have migraine headaches, that may be a very inexpensive way to reduce the frequency and the intensity of migraines. So think about that one as well. The next one, I guess, would a combination of supplements of minerals, which really are selenium, silica, zinc, boron's usually in that mixture, and those are usually combined in one formula, in like a bone formula for joints health, and sometimes those can be a benefit, especially if you have a deficiency in it. There is a form of silica called diatomaceous earth that some people use that found to be beneficial. You might want to look that up on the internet and think about that as something you can mix up and drink. Maybe 2 weeks on, a week off, 2 weeks on, and see if that helps your joints a little bit. I happen to use it, and it's helpful to me, but it's something you have to mix up in water and drink it down. It doesn't taste very good, but it's sort of bland, but it might be worth something that you can look into. Only side effect of that I've seen is that it seems to work as a detoxification process, so you really ought to have already changed your lifestyle to be on a very good diet. And again, go back and look at some of my other YouTube videos where I talk about the anti-inflammatory diet, because you really need to do that first, even before you're adding any of these supplements, because that just makes everything work better. And you're sort of, if you keep eating the same old bad diet that causes inflammation, and you're trying to uncause it by some supplements, you're sort of kicking yourself, sabotaging your own efforts. Okay. Besides that, there's some other supplements that have all of these in it, and you can go online and read about different ones, but all these together, there are some formulations where you have all these together in one pill, and you take 3 or 4 of them a day, and actually they can some even add cat's claw and some other anti-inflammatory supplements that are a little bit unusual for people to know about. You just need to watch how they interact with your medications you're taking. I kind of like to take those in the supplement form, if they're together on an empty stomach twice a day, maybe right as I get up in the morning, and maybe as I go to bed at night. That's probably the best way to do that. And the next thing I need to add, and that is fish oil supplements. Fish oils are some of those oils and fats are actually very beneficial for people, and not what we've traditionally thought of. So some of the fish oils and coconut oil, macadamia nut oil, and hemp oil, some of those are actually quite beneficial for the joints, and you might want to add those to your diet. Now, I would suggest not adding all these at one time. It might make you sick. And if you have an interaction, if you have a bad side effect with one of them, you might be allergic to something. It'd be better to take one at a time until you figure out what your body really needs and what seems to work for you. So it takes a while to kind of sort this out. You may need some professional assistance and go to a nutritionist or something or an alternative medical doctor to see. But here's some ideas for you to follow. Remember, start with the anti-inflammatory diet, then add the nutritional supplements one at a time. And again, God bless you, and make food your medicine. This is Dr. Mark Cooper. I'll see you at another time. Bye.